So we have this morning this lady, 88 years old, with dysphagia since now 1 month. And on endoscopy, we have upper esophagus obstruction. So we'll begin our endoscopy. So the purpose today is to place metallic stent. We will use a partially covered one. So this is, we are searching our air. This is the T-tube there, so we should cross from here. So this is our esophagus. We just will clean, maybe some food is blocked there. So the upper sphincter is at 15-16 centimeter. I have really to clean all that before doing anything. اعطيني باسكيت شو اسمه اعطي الفيلي باش نخرجو نتاع البوليب باش نخرج تفشل ولا حاجة. ها ولا هيت اونس هيت. So I need to extract all that foreign body here. اونس 15. فما خيط متعدي بعده لي هنا جاسم هونك. فما خيط متعدي على السكوبي وطلع لي سكوبي لفوق شوية. هلا سكر بشوية من غير تكسر لي باس بيزو. خليك سكرت سي بون. حل سكر شدك هيك. مش نجم. لازم الريزيستانس يعني تشدها. سكر شديته. حل سكر كومبريس حل سكر سكر البيبان. اغزر لي ريت الباب هذاك بالمفتاح يتسكر باش الحس ما يتعداش راهو. حل سكر حل سكر. اغزر ريت بدا محلولة ما فماش بريسيون ناهد ما نجموش نخرجوها راهو. ما لازمش تتفرج على الاكران، لازم تحس ديما تقعد نازله بشويه عليها باش تحس تهرب لك. حل سكر. حيت. أعطيني كاب أعطيني. كويس. حضر في الجديد حضر. يتحل انت عاد. نظف نظف شوي علاش نظف حطه في الجديد وحطه يزبع عاد هذاك لوح كل هذاك. ليه تبعد لوح بلا لوح مش علينا. دور طاولتك دور شو بدنا نضيف على قولنا الدور. اعطيني في الجيدة. ركح طاولتك بعدك الدبابز وكل شيء بعد ما تمدليش حاجة باش تطيح دبوزة في القعرة وبعد سوغانج وفيكسي طاولتك. So we'll proceed now with the wire. So the lesion is at 23 centimeter. We have 6 centimeter to place our stent. I don't have any idea about the length. امشي امشي امشي. اقعد هكاك اقعد. اجبده. امشي امشي امشي. So we see now the wire going in the esophagus, so it should be the good direction. So what we will do أهبط لي اللوطة توا. So we have to see أهبط اللوطة الكل. We have to see the loop inside the stomach. This is our loop there. So I will switch to the fluoroscopic view. So this is the loop, this. So this is our loop there. So we are sure inside the stomach, no fistula, no perforation in the tumor. أطلع لفوق توا. So we will come back now to the scope. زيد اطلع زيد. طلعوا الطاولة طلعوا. C'est bon. Ben, inject here. So we will put some contrast here. Some. So we see the limit of the stricture. The beginning is here. So I will push my inject here. So and we see that maybe all that is the stricture here until here. We see the marker there. So we have almost 7 centimeter stricture. Inject. Stop. Inject. My cardia should be here. Inject. أعطلو شوية ترى. Stop. So we hear stomach there. This is the lever of the cardia. So we can place our stent until here or maybe cross a little bit. I'm trying to see if I can cross, but I know it's impossible. It's really tight structure, so we won't even try. Like this. So we'll exchange, we leave the wire there. اطلع لي تو بس لفوق شوية ترى. بربي طلعوا الطاولة ماكسيموم هذه طلعت ولا هبطوا سكوبي. حاجة من الزوز. تمشي. قطع. سي بون كيكا. بعد لي الباتش بتاعك بتاع لو سي جي بتاع السكوب هذاك غادي يبعد عليا. واعطيني دو باتش بتاع سكوب اعطيهم لي. So we check always the wire is in place. اعطيني دو باتش بتاع لو سي جي. مش اعطيني بالون ديكستراكسيون 15-18 اللي عندك هاتو. So I don't see clearly the level of the obstruction in the lower esophagus. So what we will do, we will use an extraction balloon of the ERCP, 15-18 millimeter. We will push it through the stricture. It will cross, of course, easily. We will inflate inside the stomach and we'll pull it back. And I will see exactly where the level of the stricture and put the marker there. Because even with this contrast injected, I can't see clearly where we are. So I will just put myself here, just inside the tumor. I will put some contrast here. And you see, we see clear esophagus, the upper one, but I don't see contrast. So we see almost the 6 centimeter stricture. حط في الجيت حط في الجيت. عديت ما فيها. عدي ما قاعد نخدم انا توا شنو. So this is our extraction balloon. So on the fluoroscopic view, the distance is really clear. So the balloon now is in the lower part. We see our balloon, the marker here, entre 18. So I will inflate to 18, and we see my balloon here, and here it's blocking here. So this is the level of the stricture. أعطيني الباتش وينه؟ نقول لك وين، عرضي عرضي. C'est bon. هات الباتش. So we'll put the marker here, the fluor. نحطه احنا هنا. حطه هنا. حلو حلو. فيكسي غادي. So this is the level. استنى شوية. ده فوقاني مش مشكل. So we put the lower. في الشيء. ولا استنى اوف. Inject the contrast. So we'll put some contrast. اهبط لوطة بالسكوبي. سيب bon. سيب. اهبط شوية. Injective. So we see the lower esophagus there. C'est bon, c'est bon. So now we have fisheye. So the level of my stent should be at least here. We have the cardia here. So we should cross the cardia, because if you put the distal part of the stent in the cardia, it will be with the muscle closer there. So I will just measure now. We have to put our stent from here. This is our tumor. So we need to put it. اطلع لفوق شوية سكوبيدرا. هنا هكاكا. So this is our marker. We see the marker, so we should push it from here until here, and this will be maybe 12 centimeters, so it should be okay. This feel good, huh? So now the last step is to exchange. فش البالون. فش. خذ سورينغ دو فان وفش. This feel good, huh? So we'll use a partially covered stent. أعطيني l'emballage ده. أعطيني باتش آخر ترى. باتش. يجي حل هنا، حل التنقل. هيدا التنقل لك. حل. So we just put the other marker here. So this is the distal part. My lesion should be here, and I can release my stent here. So we have the two marker now. But really, we don't need the upper marker, because I'm always do my releasing of the stent, my deployment, and the fluoroscopic and the endoscopic view. أي البروتيزة. تعطيني الامبلاج. حل شمك. تعطيني الامبلاج. So I don't know if it will be clear here, but we will use خلنا هكا. لقيت الفيلقيت دخلته ونزلت. يخوض. دقيقة. So this is our screen. Just بربي شد انت هنا هكا. So this is, should be 12 centimeter, and if you see clearly on the picture, it is a partially covered one. So we have 11 centimeter covered and 1 centimeter more, or maybe 1/2 each part that is not covered. So that will help to fix the stand. So now we'll exchange our wire. So we'll keep the wire inside while pulling back our scupper. We have to be sure that the wire شد في الجدار. شد جاسم، شدوا عندك. شد اجبد. يجيني ليش. So now I leave my ايش شد لي هكا ايش. شد لوندوسكوب. شد. عطيت البروتيزة. عطيت 100. ها عديت ولا؟ سي بون سي بون. So this is not a through the scope stand. So we have to place it without the scope. It's maybe 16 or 17 French, less than 1 centimeter. خرج المزيل. ايش بدي؟ سايبة أعطيني كزيلو. So we put some gel and we will push slowly our save just mine. So I need now to see my stand crossing the upper part of the esophagus. So something important, I will push slowly here. So with little movement here, it should cross now, and it's crossing here. We will see it arriving here. And if I feel some resistance, I will pull back my wire because I have a big loop inside the stomach. So this is the part, the most difficult part. We have to cross the stricture. I don't always need dilation, just with little pushing, and we should cross. We are almost crossing here, and we crossed it now. So we are inside the stomach. So I have the marker in the middle now. I see it coming. We have the distal marker in the stomach now. I have one in the middle, and I will push, and I need to see my distal marker, which is just facing the marker there. So, and if I push a little bit more, you see the proximal part of the stand. So I will pull it back, and I can begin releasing here. So for releasing, I'm not sure I will be able to cross with the scope because we have a little stricture in the upper sphincter. So I will just try to, with little movement, if I can cross, if it's okay. If not, I will just release it under fluoroscopic view. So I think it will be almost impossible to cross. We will follow the patch of the stand, and I can't cross here, so I don't even will try. I should do it. So what we will do today, it will be only a radiologic releasing. So I have my upper marker. أعطي اللوطة شوية ترى. سكوبي. إجا شد انتي لوندوسكوب إجا. So we won't see the endoscopic view. So I will release my stent first in the stomach. So I will push, and you will see on the fluoroscopic view that the stent is opening in the lower part. So now I will pull it back. I have my marker there, so I can leave it here. So this will be okay. ترى اطلع لفوق توا. اطلع لفوق. I now I have to focus on اطلع في اطلع زيد 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 زيد. So I will just pull back my sheet and try to keep the stent in the same place. And in this position, I will release the stent, but not the best. So I will pull it back. I need it to be really back here because you have to remember that it will shorten. أطلع لفوق شوية. So we continue releasing, and I need really to be up here. And it should be okay now. I have my marker there. And now it will be released here. And it's fully released here. So perfect. So now I can pull back and take it all my sheet here. So I tried today to put the scope marker. They're not the best one, but I'm pretty happy with this position. So we will now check our endoscopic view. And this is, we should have maybe 2 centimeters space between our stent and the upper sphincter. This is our entrance, and you see that the stent is really well deployed. أعطيني contraste. So I will try to clean this and then put some contrast to show you how everything will be clean. أبدأ فيقي. So this is our contrast here coming, and it's crossing easily. So the question now is, should I fix the stent? We have the uncovered part here, which should be okay, but maybe I will أعطيني a clip. I will put maybe just one clip for the first day here. Says so it doesn't cost anything, only a clip. So we'll put maybe one or two, but usually I feel better when I have one clip or two fixing the stent. So we see clearly the marker we put inside, behind the stent, we see them then. So remember that the stent will shorten a little bit. So I want to grasp the metallic part, not the plastic part, but only one, like this. سكر شوي سكر like this. حلي. سكر شوي اقعد هيك حلي. حل كل. So like this. So I fixed one piece. أبدأ سكر سكر مرة. So one is fixed there. So we can put another clip here. حل استنى حل. But I think I will just leave one. She will get little inflammation fibrosis here because you have the metallic part uncovered here, and we see the covered part is here. So I think I will just leave it like this, only one clip. Ah, c'est bon. Excellent contrast. So the last contrast injection. And everything is clean. So she will be discharged today. And you see we have almost 2-3 centimeter space between the upper esophagus sphincter and the stent. تحت بلوطة شوية راحة. So last view to the up, and we see this it's fully opened in the stomach. I don't need it to be opened just before the cardia. So it looked perfect. سجل لك كهوة. So she will be released today after maybe 2 or 3 hours. If there is no pain, no complication.